Okay.
in North Cove.
So we're-
And I think your house, I'm behind you diagonally.
Oh, okay. Okay.
I know the house because I used to know the people that lived there.
Oh, that's right. You're right
Yeah.
behind one
Oh,
another.
okay.
Yeah.
Which family did you know?
The Morrisons.
Oh, yeah.
That was
Yeah, that was a long time ago, yeah.
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 You know what, here.
So I know, like,
It's not the house behind you, but it's.
the one next to that. Okay. You probably hear me in the summer yelling at my grandma.
No.
No, that,
Yeah, if you ignore it.
because they're always wrestling in the pool and.
So we're gonna go directly to audience of citizens and we'll put Tina and Karen on first.
Okay.
You don't mind, do you?
No, of course.
Okay.
Okay, so you met the March and April, I think, because we didn't meet
Yeah.
last month, right? So, the clinics are quieting down as far as illnesses. Okay, so we're getting the routine blood pressure, cholesterol, diabetes, things like that. Identified a couple of skin possible melanomas. So a couple of people who had come in with some very suspicious things and referred them, yes, definitely, you need to go see your doctor for that. Another woman who had come in with some incontinence issues, not really sure why. So again, referring to her doctor first and then talking about proper hygiene and the products that are out there and how she could get a hold of those type of things. A couple of foot problems, gout, somebody with an open sore who had peripheral vascular disease. So making sure that that was being followed up on. Got a couple of calls from the police, not me personally, but they had called the Youth and Family Services.
Okay.
And then they also have my email, so I got a couple of emails from them.
Okay.
One-
To check on people.
To check on people, yeah.
Okay.
There were a couple of home visits through Saybrook Village, which, they were just very simple, not feeling really great. Can you stop being really quick and making sure I'm doing okay type of thing. And there wasn't any problems, but, the police called to one case where the woman was unable to stand up. She had been sitting down too long, and she had no feelings in her legs. So the police were called to lift her up, and once she was lifted up, they didn't feel the need to transport her anywhere. She was able to get going.
Going again.
But when they were there, they noticed messy house, and she looked a little bit like she was declining. She mentioned some health issues. So,
Was there food?
so there was food. She has a sister who is taking care of her and stopping in at least once a week. She has kidney failure. And she had previously had a fall, so she was in a lot of pain and not moving as much. And then she just stiffened up so much to the point.
Yeah.
So, I gave her all our resources and let her know, there wasn't anything really to do. She had seen her doctor. She did not see the doctor for the fall, so I encouraged her to do that just in case. But she had been seeing her nephrologist and her other primary care doctor on a routine basis. So didn't really see any intervention need to continue
His sister
seeing her.
lives with her?
No,
Mm.
no, but she lived on a third floor apartment, so it was kind of hard for her to get up and down stairs and things like that. So the sister was pretty much taking care of her after this fall, to make sure she was doing okay.
Okay, yeah.
But that was a good call by the police. The
Yeah, it
second one,
was.
the other call that we had gotten was for a woman, upper 70s, and she was at her home, but she couldn't remember how to get into her house. So she had her keys, but she couldn't remember how to open the front door or to go in, so there was some confusion there. They did send her to the clinic where they checked her out, didn't find anything significant, but she was still having memory issues. So I did a couple of home visits. The son met me there. Made sure that she, he took away her keys. She was not to be driving anymore, that type of thing. We got appointments and made sure that she got a follow-up appointment with her primary care doctor. to talk about what's happening with this memory issue, even though it didn't seem to be a stroke or anything like that, but
It just
that-
sudden, it was.
it was
sudden,
very
not
sudden,
oh,
very sudden. Well, she had had a traumatic event. She had just received some news that a brother had died, some brother that lived out of state. So I think that might have been the catalyst for something else that might have been coming up. But come to find, she's a hoarder. The house was in shambles. And yeah, so there's those issues as well. So, but the son is involved, taking care of a lot of those things.
Yeah.
And I'm gonna pop in and see her tomorrow
Good.
just to make sure.
Mm.
He didn't want to go with an agency, so I only have one person left that does private caregiving. So I don't know if any of you know of someone who needs jobs as far as the private caregiving sector. Certainly let me know,
Okay,
you
I often had a couple of people. but
Yeah,
don't know
I
if
always had a
they're
couple in my
doing
back
it.
pocket, but now I
Yeah.
only have one and,
She's filled or he's.
she's really, yeah,
Doesn't,
yeah,
qualify for any other services.
not at this point, no. Mm-mm.
Mm, That's an, you know.
But that was the thing, I told the son he really needed to work on the power of attorney
Mm,
type of thing. We had that discussion again and getting her to see, a gerontologist or a neurologist to really find out, is this beginning dementia? They did check her. It is not a UTI. It wasn't a UTI kind of thing going on. So, not really sure where the memory issues are coming from.
Things will keep occurring and then,
Yeah,
yeah,
please get called out another time and another
Yeah.
time and,
and
So-
that's how things
Yeah.
kind of they get into the system and, they'll get more help,
but the son is taking, good
Yeah.
care as far as the financial
Does he
piece of
live-
it.
is
She
he-
hadn't been taking her medication, so that was
Oh,
another
maybe
issue.
yes.
So I transferred all her medicine shop and got those blister packs ordered for her. So that, to see if that works, if that wasn't gonna work, then we would have to, possibly get a referral for other, so to get more VNA services in there for it. Handle the medication piece on an ongoing
I
basis.
didn't know they did blister packs.
And they deliver, so it's.
Wow, that's great.
So they're a good resource. Yeah,
That's great.
She's
I
only in
didn't
her
know that.
70s.
yeah.
That's wonderful. And do they do convalescent homes? too?
I don't know.
Yeah, that's great. That's really great.
Sounds like
Yeah.
she'll need a nursing skill at some point.
At
soon.
some point, yeah.
Eventually,
Yeah.
I'm visiting nurse.
Really?
Like, the son has his hands full right now because they were sort of estranged. He lives out in Torrington. So, for him to come back and forth for all the doctor's appointments and, but now he has to because of the financial piece and he's working on getting the house cleaned out and, all of.
He may not have, he don't know how she was living.
No, he didn't.
Yeah. So he wasn't right on top of it.
Not right to prevent it, right?
Yeah, she is. And the older I get.
I know.
It's like-
Younger.
Yes, and so the other thing I wanted to bring up with Tina is, I had a discussion with Karen and Tina, and you know how we were trying to have Tina stay with us and work part-time for the VNA, but that's not gonna work out, unfortunately. So we're gonna, at the end of June, we're gonna lose Tina, at least for a while. I don't know, maybe we'll be
You
able
never
to.
know, right?
I
It
know,
may resurface somewhere else.
right, but Tina did find another person for me. I gotta find her name.
Deborah,
Yeah, Deborah Langer, and I spoke with her on the phone, and Tina has spoken to her a few times. She does what Tina does, what she did, it was called a family,
family partnership.
right, and she did a lot of maternal and child health. And, maternity visits, but she's also a VNA nurse and she feels that she could step in and, pick up for Tina when Tina has to leave us at the end of June.
Would we hire her for,
I'm thinking she doesn't need, she's Medicare age, so she doesn't need insurance, but we would probably hire her as a consultant, kind of like we do with Michaela, but the contract would have to be a little bit different. Carl and I would have to figure out.
So it would be an individual contract versus
I'm
an
sorry.
individual contract with her?
Yes, yes. Now, see, now we have the contract with the VNA. With Michaela, we have the contract with the estuary, but with, Joan, we would have to have it with her because she's not involved with any agency. She does have her own insurance. And Carl and I spoke about the possibility of giving her a yearly stipend to help her pay for her insurance. And then she would just be hourly for us. But we gotta work it out. We have till the end of June. And Tina said that she would be willing to work with her all of June and to have her shadow Tina and do all her jobs and learn the ropes so that it would be an easy transition. Plus, didn't she fill in for you?
No.
Originally? That was the other.
No, that was the other nurse, yeah.
Yeah.
how many hours is that full time?
No, we're talking 8 to 16 hours.
A week or?
A week.
A month?
A week.
A week,
Okay.
yeah.
And do you, because it's a town job, do you have to post this?
No, we don't have to do.
No, I wasn't sure if,
No.
there is some kind of.
No, there isn't. I asked Carl that.
Yeah, okay.
Well, we had a long meeting when we were talking about what are we gonna do now that the VNA isn't doing wellness, and we thought of all different possibilities. And he says, no, he says, and we could just contract like we were gonna do with the APRN.
Right, exactly.
It'll be very similar to that. And I already wrote that up, so for me, that'll be a little break. I'll get a little break because I'll take Tina's position as we have it with the contract, and then I'll take the one I wrote up for the APRN and the one that Michaela has. And kind of fuse them together and be able to come up with a position and what she's gonna do, but it's really gonna be, she's taking over your
The hours and,
and
yeah.
everything
Right.
she does, and
Clinics,
she's willing to do it.
Yeah.
I haven't met her yet.
Okay.
I'm gonna meet her, yeah, and maybe I'll have her come in last meeting or call a special meeting if I have to. You guys wouldn't mind that, would you? We gotta do it just to meet her.
You're still meeting in June?
Yeah.
You want me to talk to her, see if she can come to the June?
Yeah, that'd be good. I still have to talk to
I won't be
Carl.
able to come to the June.
It's at the end of June, right?
19th.
It's
Yeah.
the third
This
week.
week,
19th.
Okay.
Yeah, or we could do a special meeting, maybe the beginning of June,
Okay,
and have the two of you come.
maybe that's better.
And then we'll call a special
Yeah.
meeting just for that. If you call a special meeting, it has to be, you have to post the agenda item, and that's all you can talk about.
Okay.
Yeah, so we can do that. It might be a good, so everybody can meet her at the same time. Yeah, we talked on the phone for quite a while, so I'm not worried that she can't do the job.
No,
She's got a lot of experience.
And she's an old Saybrook resident as well.
Oh, yeah.
So she's,
Oh, yeah.
she's, really,
Right.
wants to do stuff for her community.
And she, yes, she was very excited and.
Being retired from.
No, she's going to be, yes.
Right,
So now why would you do a stipend for insurance?
why would I?
To offer her a stipend for insurance? You were talking about that.
Well,
if it's 8 to
I don't know
16
if she's
hours.
gonna have to, I don't know what she has. We have to make sure she's covered,
I see.
you know, because if she gets sued,
Mhm.
you could rest assured they'll sue the town
Mhm.
So you're talking about
or
nurses.
try to sue the town.
Yeah.
So you
Yeah,
wanna
yeah,
make
I
sure,
agree,
yeah, she
Yeah.
has
Yeah.
good
Yeah, it's a
liability
malpractice.
insurance,
Yeah.
you know.
I got
Right.
I do.
So-
I was thinking medical insurance.
Yeah, that's what I was
Yeah,
thinking.
okay.
That's what I
Oh,
thought.
she doesn't need
No,
that.
no, I already, then you were talking
That's
about
what-
saving for
yes,
insurance,
that's
and
what
I
I
got
thought.
confused.
Oh,
That's
I'm
what I was-
sorry.
that's what I was-
Yeah,
Oh,
Cause I,
No,
that's what I was
maybe
wondering
she's full
too.
time.
Yeah, okay, I was
don't know.
confused too, so.
Liability.
Yeah, okay, that makes more
Liability,
sense,
yes.
yes, okay, yeah.
Yeah,
I'm glad you asked.
I'm glad you asked too.
Yeah. But we'll be talking
It's
more.
like $100 a year.
Yeah.
Yeah, that's what you had
Yeah.
said. Who looked it up? Oh, no, Priscilla was the one who
Yeah.
researched
Like
it.
100.
She thought it was 100 a year.
Yeah, well, it might be a little bit more than that now. Sure.
It's closer to 300, but yeah, it's not that bad.
And that's the kind of, that's the kind of thing that's in the contract that we'll have with her, you know, that she maintains her insurance and she follows the HIPAA,
Yeah.
you know,
Yes,
that all is,
yeah, all that, okay.
yeah, that has to go in there and
Yeah,
then
okay.
Carl signs it and she signs it. And then we'll do a budget for her
Great.
salary and all that and how much she's gonna make. And
Perfect.
we have the, whatever we're paying for the services that Tina's doing. That's our budget, the V&A budget that we post every year.
Okay.
Yeah, so, and Carl said, you know, you can spend that. That will be what you have to spend.
All right.
So, we're gonna have to-
Is it going to stay the same? Is it going to go up or down, or do we know?
It should be stay the same, I imagine, right?
What's that?
I imagine it would probably stay the same.
The money,
The budget,
Yeah.
is the
Oh,
budget
yeah.
going to stay the same?
it is, because it's the same services and,
Well, I mean, I guess the town does a budget every year.
Yeah, if we don't use it all for a couple of years in a row, they might.
no. And there's-
You know,
We always help you find money to spend. That was-
And Tina, you know, she's gonna see, you know, maybe some down the road a piece, something will happen with the VNA and she could come back to us. And then, you know, we talked to Joan about them working together.
Oh, Deborah.
Deborah, where do I have Joan? I better write it down.
Let's call her Joan.
Deborah.
This is happening because
the
DNA is not anymore.
Right.
These students pulled out of,
Yes,
because Tina's contract with the VNA.
Yes.
That's why she's.
But it's not the VNA of Southeastern Connecticut anymore. It's-
Right, they only paid enough.
Right,
Yeah.
But it's because.
Well, they're not doing any wellness anymore. And a lot of the VNAs are not doing wellness anymore. Because I checked with.
Because people don't
Melissa.
get sick anymore.
Right.
We're all very healthy.
So that's, I just wanted to talk about it and update you. Jay, you have any questions?
No, I think we need to move forward and have her work with Tina for at least a month.
Yep.
Now, whether, you know, she spends the same amount of time, who knows?
Yeah.
Maybe do a timesheet for us if you think that's necessary, or initially, what do you think, Tina?
I'm not sure, I mean, because she is still currently working, so I.
Correct. Yeah,
Have to make some time off. She's gonna.
Deb is going to have, you know, her own caseload that she is working through the end of June, but it is starting to dwindle, you know, it's starting to lessen and come down. So by mid-June, I'm thinking she's going to have a lot of free time. So you can can probably talk about squeezing in some things. I'm not sure where her caseload is right now. But it will start, we will be cutting it down fairly quickly, starting probably within the next couple of weeks. So
Okay.
she'll have more time than she does
Yeah.
right now.
It's mostly the relationships. Tina has worked with these people, I don't know how many years.
Absolutely.
And to get them comfortable with a new person, a new face would help.
And Deb is, you're gonna love Deborah. She's wonderful. She's lovely. And as Diane said, super smart. She's been doing this a long time. She's been a nurse a long time, has got a lot of experience. And this, I had not heard this, and I'm extremely happy to hear this news. I think it's going to be really, really good for you and good for her. I'm very, very pleased.
Yeah, I'm listening to all these people, so I'm feeling good about it. I think it'd be a good plan. And then we still, maybe down the road, hopefully we'll get Tina back. I'm on that. So.
Absolutely, absolutely.
Tina will start her own company.
Tina, no, you can't have her just yet. I'm taking her for a while.
Possibility, you know. All right, anybody have, and Karen, did you have anything you wanted to bring up, discuss?
No, I don't. You know, it's businesses as usual until actually it's going to be June 29th. June 29th is the Monday. It's a payroll Monday. So that's when.
It'll be the last day. Yeah.
Yep. Mm-hmm.
Right. So.
All right. So, but other than that, it's business as usual, and we'll just continue to roll through it.
Okay. All right. So changes, we just gotta roll with it.
I know.
And,
It's hard. It really is. It's hard.
yeah. What now? I'm just curious. What will happen with the clients that Deborah's working with? Will they be referred to out anywhere, or will they just end?
For her program, we have to look at exactly what their needs are and where we can refer them to have those needs met. What programs are out there to have those needs met. Some of their folks are getting to a place where they're aging out of the program. So there'll be some who will graduate the program, some who will just kind of say they're done with us if they can't have their regular nurse, and some that we will refer to other programs as we can find them. Mm-hmm.
Well, that's good.
Yep.
And they probably go to WIC too. There's probably counseling through WIC.
There's all kinds of stuff that's out there. It's just going to be a matter of really going through each case and figuring out where their biggest need is.
Well, you guys got a lot of work to do too. All right.
Yes, we do.
One other question, Tina. Do you have any documents or worksheets or that are on file that need to be transferred or kept, or what? I just don't know what kind of material you have that might need to be passed on or could be or can't be or.
Well, I think since we'll be starting in July, I mean, all of it will be new, you know, as we always did the new, or is it someone who's returning? So I will show her how I do the documentation, but I believe the documentation has always belonged to the VNA. But, you know,
her documentation now really we don't really want it, because we're not a clinical agency. She's gonna be keeping her documents, she's a contractor. She
No, I
keeps
understand that.
documentation, she knows what she's gotta write down and keep track of.
And you're taking that with you for each, any notes you took for each patient, you're taking that with, or that belongs to the VNA.
Yeah,
Right.
No.
that'll be in a chart for however long, probably 7 years, I don't know how long they keep it. And then it's destroyed. Well, that's pretty much how they, VNAs keep their material. You know, is it about 7 years, Karen, something like that?
It's 7 years for some things, it's 10 years for other things, it's 15 years for other things. It's a very confusing.
I know, but they
You
know
have to, but it's a long time.
their medical records.
Correct.
Legal purposes, we need to keep documentation. Just, I believe for legal purposes, wouldn't we, if anything occurred with the client?
I can work with her to develop something like that for her and you to work together. I can show her how Jay does the reports, those monthly reports,
Right.
so.
I mean, if anything happened to one of the patients and they wouldn't, I mean, you need to have a record.
Right, but she would keep it on her own. The town wouldn't keep it. You know, it's her record. But she's a private contractor. So she would keep her own records. I'm gonna check with Carl again.
Yeah, I
about
just
that,
think
but
we need to
I'm
get
pretty
some
sure, like,
legal
for
advice on
example,
that.
our nutritionist,
Yeah,
Kathy Cobb.
Yeah.
When she does her programs.
Yeah.
She keeps track of everything and she keeps it for herself.
right.
You know, we don't,
Well, I understand why we wouldn't be looking at the records, that's for sure, but I don't know.
She'll be
if we just
taking
need
her own, I'm sure. Yeah, that's.
pardon me,
I'll be showing her how
Yeah.
to
do
record
it.
and everything. Yeah, oh, yeah.
Well,
It's something that we
yeah.
naturally do.
will be similar to what she's keeping
Sure.
for her clients.
I think once you write up the contract, that you can put in there that she would be responsible for
I
keeping
think
her
it's in
records
there.
and
Yeah.
having them available for the length of time that,
Yes.
and should anything happen that she would,
Yeah, that's all in there.
yeah, and that's,
Yeah.
and then we're all set.
It's very detailed, because,
Yeah, because we already did.
and
right.
Carl's a lawyer too.
We
So
We got that.
You know, I wrote it and then I sent it to him. He says, well, I'm gonna change a few things. He changed, the legal stuff and then sent it back. So I'm not worried about it. We'll get it done. Right. All right. Taking a long time. Poor Michaela's sitting there. All right, we're gonna move on to Michaela.
Right, so I only brought April. I forgot that we didn't meet in April for March, but so I have my April report. So I saw 23 unduplicated clients that included mental health assessment, referral, bereavement group, educational program, and 3 community outreach programs. Bereavement group saw 9 Old Saybrook residents. Tina and I did an awesome educational program at Saybrook Village, which was so it was slime. A lot of the we saw 9 clients come for that. They were a little for the slime program.
Oh, the slime.
Yeah, so they
okay.
were a little skeptical of that, I think, in the beginning. But I think they had a great time. So it was very much anxiety, stress reduction. And it promoted, Tina did a really good job with talking about the fine motor skills and how to figure that out, or how to work with the slime, as I went to individual people to figure out what kind of color they wanted, how to make the slime. So it was a really fun program. I think they had a really good time.
Well, they all ended up laughing and
Yeah.
smiling at the end, so.
Yeah, I think
that was our goal, was,
Yeah,
it's
we
good.
want to improve your mental health.
Yeah, and I think they stayed a lot longer than our normal programs.
To-
So I think it was a good success. And then the 3 outreach programs saw 11 engagements. That was 6 unduplicated clients. I saw 2 clients for intake and mental health assessments, with both of them getting mental health referrals for additional services. One client came back for additional referrals, so I think she was from my February month. She just wanted another list of referrals. And then 3 clients came back for follow-ups and individual meetings.
That's great.
Yeah.
I have March too.
Oh, good.
You want it?
Yeah. So March was, I think, they all kind of just go together.
Yeah.
After a few weeks. So March was 20 unduplicated clients. Bereavement group saw 7 Saybrook residents. Yeah, we did the anxiety and depression, symptoms and treatment program, which saw 6 clients. 3 outreach programs saw 12 clients, 6 unduplicated, and then another 2 clients for intake assessments. Both saw referrals, and then 4 clients came back for mental health. Yeah, follow-ups for mental health. I'm sorry, I'm just thinking back to that month.
I've gotta go back. to the
Yeah.
past, right?
Yeah, it's crazy how much these months like kind of just blend together. Yeah, so it was a very
And I listened
successful,
to their song.
very successful and busy couple months. I thought that the winter and like spring would kind of calm down because summer is
Yeah.
very much our busy months.
Yeah.
No, it's kind of just everything is
Thank you.
just staying constant.
I
So it's
know.
been pretty busy.
Yeah, and I'm really happy at the numbers and how it's going and it's just, it's wonderful.
It's
I
also
really-
wrong. It just.
Yeah, so for the most part, I do know a lot of my, it's funny, some of my clients do, so I'm in the estuary, so the senior center, so we have lunches, so I have some of our employees and volunteers listen and talk to some of our clients and they go, oh, you're having about, you should go talk to Michaela. And so a few of them will come. I've seen, actually, it's funny, I've been at the estuary for 3.5 years and we've been next to senior housing for that entire time. But I think I've seen probably 2 or 3 clients that I've never seen before come to the estuary and just utilize the services and just
So it's
come to
working.
lunch. Yeah, it is. I think
Yeah.
slowly but surely. I don't know what it is. Maybe it's just because the spring and it's getting warmer and sunny out and they're ready to kind of change their habits. But
Yeah.
yeah, it's slowly. I saw one of our,
Or your familiar face when they
Yeah.
come in for their blood pressures and
Yeah.
Michaela is there too. working
And you're
together.
going to them and they
Yeah.
see it, so they're gonna
yeah,
come
I
over to
had,
you and use the services.
yeah, I had one client this past week say, you keep coming to see me, so I thought I'd come to see you. So she just came by and started talking.
That's good.
And she's
Yeah.
sweet.
Those are the people we were talking about during COVID, when Tina first presented the issue to us. of
Yeah.
All these isolated people who were really decompensated over COVID, and
Yeah.
we lost many of them to bad outcomes, unfortunately.
Yeah.
So I'm really happy with the. way
Yeah,
it's
I am too. I think a lot of, I am seeing a lot of kind of younger seniors, like 60, 65, 70, doing a lot more self-referrals than I think the 80-year-olds. Yeah, so I am seeing a lot more, I think this past few weeks I've seen, yeah, probably not yet retired. So probably like early 60s coming to see me. So it's definitely good. I see a lot of newly retired people figuring out that the life transition of retirement is a little bit more tricky than they thought it would be.
Now,
So reaching out, yeah, so what's the next thing? So kind
Yeah.
of figuring out, this is tricky, I need to I need to find a mental health referral. And that's what I'm there for. It's really good.
Okay. Anybody have questions? Okay.
I'm all set, you know.
Very good, sir. Very good. So you guys can stay if you want, but don't. All right.
Thanks, everybody. Take care.
Thanks, Karen.
Right, let's move on. Yeah, yeah. Now let's do the minutes. You all have it. Oh, did you introduce?
I just
That's
introduced
right.
myself.
That's a good. Everybody read them?
Yep.
Any problems? Any problems with the minutes?
I'm all set.
Okay, we have a motion.
I make a motion to pass the minutes.
Okay,
Excellent.
okay, we'll second it. We have any further discussion? All in favor?
Aye.
Any opposition? Okay, motion carried. Now we have Jay, you're on.
Okay, first thing, I guess I should apologize. This is, last month's, treasurer's report. I, thought I had another week before I left Old Saybrook, so let's just cover, the April 2025 report. It really didn't change very much, for another month of, expenditures, but anyways, this summarizes the, VNA contract spending for the 9 months ended March 31st.
Okay,
Okay, and what I do here is compare the 9 months ended 3/31/25 to the 9 months ended 3/31/24. And as you could see, it's very close in terms of the total expenditures that they incurred. The one main difference is our total annual budget increased the current year versus the prior year. So that being said, we're approximately $1,600. You do it on a monthly basis. You know, the expenditures go up and down each month, but if you level it off on a monthly basis, they're approximately $1,600 below, $1,629 under the monthly average budget. Okay, so if they continue the spending scenario as what they're doing for the first 9 months, they're not going to be utilizing all the dollars.
okay,
Now, maybe let's say anywhere between $1,600 to $1,800, they may not utilize. Maybe we can think about reimbursing the person that's kind of coming in June with the extra money. Up to you, Diane, but that's something to consider. So
the other,
that being said, they've utilized about 71% of the budget.
okay,
Now, the next section, and I don't know, to the new member, we really don't cover each, Diane, you might want to explain the free care visits, the health wellness expenditures, the clinics, to our new member. And what that entails,
you mean on the regular budget?
or just on my report here. What do they do in the health and wellness visits?
Oh, the free care visits and the health wellness visits? clinic-
Yes,
Okay. Free care visits, I don't know how that got down there. Who put that?
I don't, that's always been in our budget, and
Our visits are free care, you know, and the clinics, we don't, that's just free. We don't charge for anything.
okay.
It's all free care.
But is that, the health and wellness, is that the money that we paid to Tina? Is that what that is?
Right, that's, the health and wellness is really everything
Right.
all the visits she talked to us about, her visits are free. Because our whole program is for people who either are underinsured or don't have insurance, right?
So we don't
So,
charge clients, I understand, but we're
Right.
using our money to pay Tina or the
The
nurse.
V&A,
Yeah,
yeah, we pay the VNA and they pay Tina,
exactly.
right, right,
But that's gonna end in June and we're gonna have an individual contract.
right.
And then the clinics,
Well, she runs a lot of clinics. You don't have, did you make a copy of that?
No, but I think at the estuary, she has hours there, like she has her own office. They have
The
supervisor office,
estuary.
she comes
Right,
in,
she does
there,
blood
yeah.
pressure
Blood
screening.
screening, blood glucose,
Saybrook
cholesterol,
Right.
and she does it, you know.
Blood sugar, blood pressure.
She does both.
She does a full clinic, fall, sometimes fall prevention.
Oh, that's right, the coconut.
Oh, but it doesn't say what it is.
Oh, here, yeah.
It's hard for you to, it's a little, but this is like a report that she gives us every month. And up at the top, cholesterol screening.
Yeah, so these are the screenings and then how much time she spent.
Right, right.
Yeah.
This is, here's
She's
it.
got a little sheet.
Yeah, here's an easier to read. This. Right, it's, we cannot copy the sheets.
No, that's okay.
But you can have, I started this.
It's just her way of tracking.
All right. I'll just let you look at it. Yeah. But that's what Jay's talking about. So they charge us, Tina tells them how many visits, how many people and all that. And then they charge us for her, we pay for her time.
Exactly. Yeah.
But we don't charge any
No.
of the
not
clients. It's all free care. She does, the police sometimes contact her directly. I think, the schools don't, because they have their own school nurses, so they don't really contact her much. But she's, very connected to Sue Consoli, who is our, social worker for the town. She runs social services. And they kibitz about things, and she goes to the help days where people get food and help with entitlements. So it's a big position that we're losing, and I'm really glad that we're gonna figure it out. Go ahead, Jay.
Yeah, typically the health wellness visits include safety checks,
Right,
adult health supervision,
vision, right.
and the clinics, blood pressure,
Right,
foot care,
right.
flu and pneumonia, health education, and community outreach. That's what that includes.
Right.
Next month, maybe we can distribute one of those reports and maybe talk about it for our July, our new person coming in, and kind of have her develop something similar
Right.
for us on a monthly basis.
Well, Tina, she has her own collection, system,
Yeah,
track of it, how she charts it and all that. So I think that the time she has with Tina, and I didn't want to say anything, with Karen here too, but Tina said that she'd even be willing to work with her on her own time.
oh, that's nice. Yeah.
And we could put that, we could have her give us, charge us for orientation and then come out of the budget, because we have that money to spend. There's a lot of things that we could do, and Tina really wants to come back to us, and she's really upset about the whole thing. You can imagine, she's been with us for almost 20 years, 18. And so she started with us, and so she wants to, and I didn't want to say it in front of everybody, but Deborah also said, I don't mind sharing the position down the road if Tina wants to come back. We can work together.
But would Tina come back if she retired or?
Pardon me,
Would she come back if she retired or left the visiting nurse? Is that what you're saying?
could she, you have to speak up, I'm very.
Would she come back if she retired or left the VNA? Is that what you mean? Okay.
Or if she, down the road, she's still pushing I'm getting a 3-day position.
I see.
And I
But
didn't
she
want to
has some
say
of her
all
own
that.
time.
She's
Yeah.
meeting with her union rep. And she's, gonna see, she's been there for longer than 20 years, so, you know, she doesn't have to bump anybody. 'Cause that was a thing that she didn't want to do, but she says, you know, I gave them so much for so long, I'm kind of upset they can't give
I
her
don't blame her.
a part-time position. She's,
Yeah.
you know, we've talked several times, but she wants to stay involved, so she'll leave in orange. So Jay, if she can't get it in, you know, Karen said that this Deborah has to work her hours.
That's right.
Believe me, both of them will work it out because they're
Oh, good, good.
excited
All
about
right.
it together.
Yeah,
So,
that's good.
you know, I couldn't say too much.
It's very nice that she's referred someone that,
Yeah,
sounds like she's very
yeah,
capable.
yeah.
Yeah, we were just notified when, in February or March?
Yeah.
That they
Yeah,
weren't going to renew.
a lot of, time. Yale took over, and when Mary Lenzini was in charge of the VNA of Southeastern Connecticut for many, many years. And she was very, very different. Now, once it went under Yale, it became a bureaucracy. I hate to say it, but it's.
That's every organization.
Yeah, it's
That's
a
what happens.
bureaucracy now.
Bottom line.
But I'm feeling better now that, at least we know where we stand.
Yes, yes.
We can't have Tina right now, but Tina found us Deborah.
That's very.
And, if Tina says she can do it, I believe her, you know.
Yeah, it sounds like it's gonna work out.
Yeah,
It might be and the summer months are pretty, I don't want to say slow, but they're not as busy.
right,
You know, July, August,
yeah.
you know.
I think we'll slow down, but, you know, Tina had a lot of like, they did things on the green, health days.
Yes,
Yeah, but Tina's willing even to do some of that because she can do that on her own time.
I see.
You just have to figure out how, I gotta figure out the mechanics of it with Carl, you know, and how we're gonna do it, but I'm not worried, so.
No, that sounds good. Okay, the next section, are our endowments. And we have, basically two major endowments, Flanagan Fund and the Nightingale and the Francis Morris. And the Flanagan Fund as of April, we have a balance of 87,397. We have a core, it's broken into a core and activity fund. The core is the initial funds that were donated to our board. And the 49,000 is basically the amount of interest that has been earned over, I don't know, what, 30 years? How long has that been?
Was, I think, in the 80s.
Yeah, so it's been a long time. The
Yeah.
Nightingale Fund is basically the fund that was established for our scholarships
Right,
to high school students.
yeah,
And we have a balance of 59,697. The Francis Morris, it's a small fund that was recently, I think in the last couple of years, given to the board for by someone that passed, and it sits there at 13,221.
we've taken some things out of the Morris Fund, but basically, you know, we haven't really, it isn't for anything specific. It came to us to be able to use for what we think that the town needs. And I'm, in the back of my mind, I'm thinking, when the ARPA money runs out and we still want to keep Michaela, maybe somehow we can, you know,
Yeah.
link it to that. So,
So there's no restrictions on these, so you can use them for operations?
Yes, actually, the Flanagan Fund came with no stipulations too. But the VNA at the time put a ton of stipulations on it. And we changed that about, what, was it 6 years ago, Jay?
Yeah, you changed the
Wait,
foundation of whatever the words were in the grant.
they made it very rigid, that you could only use it for like nursing scholarships and nursing education. But we don't even have an agency with nurses now. We still do provide like the nurses that do the school nursing. Every year, we still remember them with some kind of nurse appreciation, which we gotta talk about. But, we kind of opened it up. We do now an adult nursing scholarship, which it comes out of the Flanagan Fund. That say you want to go on and get a PhD, she could apply. And she has to finish a year of her program, then she comes to us and says, hey, I
And
need
that's
some.
Flanagan. So
That's
it's someone
the
who's already a nurse.
Flanagan
but wants to
Adult
increase
Scholarship,
their.
right? The Nightingales for kids graduating.
Right.
We have to talk about that too, because no one's applying. And
Nobody? Oh, one.
no, we got one applicant. Okay, Jay.
Okay, so the next page, it just kind of sums up what the Nightingale Fund donations have been over the years. And Diana, you may need to update me on this, the 2024-25 donations. What I have is approximately $10,065. I may have missed the last deposit.
Sharon and I just reviewed it. I have, you have 4 deposits? I sent you, I think.
Yeah, I don't have them in front of me, but I'm talking about total dollars deposited.
Well, with all 4 deposits, I have $11,780.
Yes, all right. Yeah, and I think I missed the last deposit there. So I'm showing 10,065, but that's all right. I believe the last email you sent makes up that 11,780.
Yes, and I sent you
The receipt, so to speak, yes.
right,
And you could also see what has been given over the years. 2023 was 20, and if you go way back to 2017, you could see we started out with only like a $4,000 donation, and then COVID hit, and I think the town saw the light and wanted to help out a little more. Anyways, the Nightingale cash on hand currently is 59,700, probably another 1,000 or so more with the last deposit. The board has approved two scholarships for the 2023-24 scholarships of 7,000 per recipient. Now we hand out these scholarships, but we pay them a year after they finish. We pay them after they finish the first year of schooling.
Yeah.
To make sure they're still in the program. And anyway, so what we may even have one other from the prior year. Is that correct?
We do. Betsy's not here, so I don't know the status of that right now, but,
Okay, so as of right now, we have an outlay of $14,000, 7,000 per student.
and maybe hers,
Yeah,
And
that's
maybe
if she ends up.
if she ends up,
She
right?
did her electives at like a community college.
Okay.
So
That's
we
right.
only pay, or she, not like community college, she at college, but the college doesn't accept you into the nursing program.
Yeah,
until the
she
second
had to do a year
So-
before she could go into the.
Yeah.
Have prerequisites.
Yeah,
So they don't accept you into the second.
so we didn't say, we said, okay, well, when you finish the first year, come,
Right.
we'll pay you,
Yeah.
so
Yeah.
we haven't, she's hooked in with Betsy, All right, so.
Okay, the next section talks about the rest of our budget, so to speak. And that the board budget from the town. We have uncontracted funds of 14,636. Nothing has been spent year to date. Admin budget, nothing has been spent. Still have $1,000. The secretarial budget, we probably have, it looks like we have given the work that's been required. We're a little over budget, but that's all right. The other fund sections will offset that.
But I'm not worried about
No.
over because.
And then the bottom layer kind of identifies what we have paid on the ARPA mental health grants. So the total grant is 21,830. I think you divided that into 2 years, Diane?
Yes.
Yes. But the expenditures through February were $2,533. So if you add March, which was $900,
Right.
and April, which was $887. So total year to date through April, they have spent $4,320.
Right. By the, I know, December, I think we, I forgot what I don't have that budget in front of me, but I know the second full year and third full year, it was to about $10,000.
Yes, yes.
Then, so I think we're pretty good.
Can I just ask, what is the fiscal year? Is it annual or is it like July to?
We're on a fiscal year from July
From July.
to end of June,
Okay.
but
So
this
our
is
fiscal year
not.
is going to be
The
ending.
ARPA is on a calendar here. I
Now,
think.
what happens if we still have monies from this year? Does that roll over or, you know, the budget?
Yeah.
The ARPA funds will. The
Yeah.
ARPA fund, that was a grant.
I see.
Are you familiar with, I guess, all that during the COVID, the towns were given funds. Is that correct, Diane?
Right,
Mhm.
this is, all the towns were
Mhm.
able to get, ARPA money. It was
Okay.
a lot of money too.
Mhm.
You
Yeah,
know,
this was
and
during
every
COVID.
town got a
Yeah.
different amount, and you could apply for it. Different agencies could apply for it, and, you know, they could apply for anything.
Yeah.
Right, a gazebo we built for the seniors, so we applied for Michaela,
Oh, great.
and because we needed some behavioral health. And, we wanted a nurse, we couldn't get a nurse, so and I'm happy with what she
She's
does.
awesome. Mental
Yeah,
health
she's
social
awesome.
worker is
She
very
really
good.
is.
Yeah.
All right, Jay.
Okay, so that's the report. It's probably a little confusing, but hopefully I can do this in person next month.
Jay, you know, I don't blame you in New York with those babies. Okay, do we have any questions for Jay? No. All right, someone want to make a motion to accept the treasurer's?
I make a motion to accept the
Okay.
treasurer's report.
All right, all in favor?
I-
Any opposition? Motion carried. Great. I'm gonna move us along, you guys. Okay, let's do, since we're on money, we have, a timesheet for,
Sharon,
and Michaela's timesheet too.
oh, she has some, oh, yes, you mean the April?
Yeah, we have to vote on that, both of them, but Sharon's is, for April, May meetings. She's also working on, the Nightingale, you know, lists and minutes and all that, her usual stuff. It totals 8 hours and a half, 0.5, and it's $195.50. Okay,
I make a motion, we reimburse Sharon for the invoice that was paid of, what is it, 190,
$195.50,
195.50.
right?
I second.
Okay, all in favor? All right, and now Michaela had two. She had the 8th.
March and April.
Yeah, because we didn't have a meeting last month. So I have April, which was 886.99, and I have March was 900. So
Well, I make a motion, we reimburse, we don't pay Michaela.
no, yes,
That's right. So I make a motion, who do we reimburse? I just don't have my notes here.
it just goes to the estuary.
Yeah. We reimburse the estuary for the expenditures Michaela incurred in March and April.
Right, and that was $900 in March and $886.99.
1786.
So you have,
1786.99.
okay, 17, so
I second that.
who's seconding Jay's motion?
I'll second that.
Okay, any discussion? All in favor? Aye. Any opposition? Motion carried. All right, good. Now, let's go to our one applicant.
I know, I read it all already.
Good, I'm glad you read it.
Sorry, it's not in really a good order, but I.
Yeah, it's fine.
Oh, it's fine, but,
I can
okay,
understand it.
so Jay, I want to just, before, we vote on this scholarship, you got
Oh, how many do we have?
one,
I did send it.
From the old Saybrook High School?
one, and possibly another one. I'll tell you about that. Sharon just told me what happened.
And we have the person that we were talking about that applied last year that might be.
Yes, and that might, will, but that's what, that's not out of this, so we don't have to worry about that.
We already approved that.
Yeah, that's already approved. But there's a second student at the high school who was in a bad car accident and she's recovering. And so she's behind in everything and she didn't have a chance. I don't know how bad she is. Sharon didn't get all the
I didn't ask
information.
any particulars, but Amy was talking to me about it. She is going into nursing, definitely.
Oh, good. Yeah.
I did not ask if she had been accepted, and I should have done that, however. But she's another good student, and Amy, I said that I would suggest to the board if they wanted to make an exception for this girl, if she is going into nursing, if she got the application to us as soon as she could,
Right.
that it could get voted on.
And I suggested that we tell her that she has to get it to us like a week to 10 days before the June meeting, because we would have to vote on it then.
Yeah, that's her.
And so that gives her quite a bit of time.
Yeah.
To do it. So, I don't know if we have to vote on that.
Well, are we voting on the other student?
We're gonna vote on that one today and give her something, I hope.
And I will get back to Amy tomorrow and let her know that you will.
We have,
You will
yeah,
accept it,
yeah,
extend
because
it.
we have that deadline in writing in our application and it goes in the newspaper,
Yeah, I
deadline.
mean, yeah, if we make an exception to one and put it off for another week or two, other students could, yeah.
But
So
as
is that
we-
what you're saying?
Yeah, and I'm saying as long as we discuss it and there's a good reason, we have the right to do that.
Well, I think that, if they're
somebody else comes up as well, I mean, there's no reason why we can't.
Yeah, if another one
Accept
comes
and-
up, yeah,
A delayed one, we can discuss it at the next meeting and say this one fit in late.
yeah, I know.
This.
This is certainly a good reason that she's.
Right, this is a
in
very good
Yeah,
reason.
she had a hardship, that's fine.
Right.
I mean, that happens.
Okay,
Yeah.
It just wouldn't be ready for the senior award night, but this one would be. This probably be the only one that we would
Yeah.
announce for the senior award night.
yeah, okay, so, I mean, everybody read it through,
Yeah.
or,
I'm reading it now.
an opportunity, it looks like she's.
Was she accepted to a nursing program, or is it something?
She's going to Southern,
Yeah. Yeah.
Southern Connecticut State University nursing program, Bachelor's of Science in Nursing she'll get.
Okay,
And she's got everything here. And, she's got a recommendation.
Oh, sorry, I didn't see that until just now, like, where did that go? Oh, that's nice, yeah.
Yeah, nice.
The grades are pretty good.
Yeah.
They're great. She's got very good
Yeah.
grades in some of the sciences. Very good.
Right, she's on HPAP, so that's.
She has a lot of absences.
No, I thought 4, what did you think?
Huh?
Crap.
Then was it this absence and then tardy?
Yeah, but they're probably the same, they're for each class, but there are, so 6 in a
Yeah,
year, that's
so-
not bad.
Yeah,
Right.
That's not,
Yeah.
could be all in 1 week,
right. Okay. Well, she's got a very nice source of
People I work
the
with.
teacher.
Of that.
She's responsible.
Yeah. And the letter behind it was so nice.
Yeah, very nice letter. She's bilingual too, which is good.
She's a very active, she's in jazz band.
Yeah.
Great
She
athlete.
does a lot of it.
okay, so just to summarize, we have approximately 60,000 in the fund.
Okay,
We're gonna be paying out 20, 2 14s and 2 7,000s. And possibly that third one from the prior year, that brings us down to a balance of 40.
so we have plenty of money, yeah.
Yes. All right.
Yeah.
And I guess it's up for the discussion on what the board wants to, I think we need to definitely come up with a dollar amount for this particular person and wait until we get a full application completed to the board and decide then.
Right, what we said, Sharon's gonna go back and.
No, yeah, I heard that, yeah.
Yeah, so we'll say we need a full application for the next meeting,
Yes,
actually a little before, so we can prepare. And,
I don't think we should commit money to that person just yet. No,
not yet,
No.
no, we'll wait till the meeting.
all right,
But we can approve this one without that one.
Yeah, this
Yeah.
one, I think we should approve, what do we wanna give her? I'm just thinking, does anyone have an idea?
yeah, over the last 2 or 3 years, back in 2020, we paid for scholarships and $4,000 each, 21 to 20, 6,000 per student, 22 to 23, 6,000 per student. The 23 to 24, we're paying 7,000 per student.
Because we have the money, we had,
Right, we had really good years,
yeah.
but this year, where were we last year?
We have a half of.
What we had last year?
Donations right
Yeah.
now, let me see, I can tell you, yeah, last year, I think it was the COVID thing.
Yeah, exactly, the
We
COVID.
got 20,300.
Yeah,
right now, we're not done yet, because it goes to December.
Right.
We're gonna give till December. We have 11,780. So we might wanna consider going back down to 6. But we have how much money?
After everything's paid this year, we'll have a $40,000 balance.
I think you should leave it.
We could.
I think
June
Priscilla
7th.
was here, she'd be giving her like double, but.
It's costing more for these kids to go.
Right,
mean,
I certainly wouldn't go down.
I think for
You
this
wanna
year,
go 7?
I think we should go, I was thinking 7,
Absolutely.
that's what exactly what I was thinking.
Absolutely.
too. And, you know, I think.
Does
long-term-
everybody agree?
Yeah.
I'm in agreement. I mean, we're only talking about 1 or 2 students here, so it's,
Yeah.
And we have to agree to the same money for the next student too.
yes. And look,
So, but we have it, so,
You know,
And I don't think the schools are getting any less expensive, so
No.
I think that.
no, I think that's great. I think you should.
So let's make this a motion.
I make a motion, we approve on a scholarship for the one application of $7,000. And I'll leave it at that. I don't think should we put anything in for this potential? No.
Do it next time. We'll do it all next time.
I
Yeah.
said-
And what if you don't get the application?
Right, exactly.
If you don't get it.
Yeah.
Yeah, we don't do it. We do have to have an application. We need to go. But
To be honest with you, as an aside, if we didn't get any applications this year, I would have recommended giving the current people a boost in their scholarship. So
well, that's another thing we gotta talk about. So let's vote on this, because I have a few more.
yes. So I made that, yeah.
Okay,
Okay, I second,
all right,
yes.
you got the motion. Any discussion?
No.
All in favor? Aye.
Aye.
Okay. You know, I'm really upset that we're getting so few applications.
So does this mean that next year won't be triple it though? So that's, you know,
Is it because they don't know?
Well,
or-
I'm wondering, there were a couple of things I thought that we should consider doing in the fall. And that is to have Betsy write a nice letter. And when we send our application to all the guidance counselors, we do it every year. I want the letter to say that we're really concerned at the low number of students that have been applying, nursing students that have been applying. And we're requesting that you copy this application and give it to each student.
but I wonder if they have a career day, because that would be something that I would be interested in doing for them. If they wanted a nurse to go,
We
you know, like we could offer
could
to do that
ask.
because
You know,
there's other,
Amy actually I've been speaking a lot with Amy
Yeah.
at high school. She actually made a copy of the application and handed it to each. There was 3 students this year that she knew of going into nursing. One of them being in the accident, and handed them the application and said, fill it out. And Lily was the one that filled
I
it out.
know, but you know what it is? There's several guidance counselors. And when Maureen Healy was like the head guidance counselor, and I don't know what happens in the other schools, but I do know that she not only got her students an application, she got the other guidance counselors an application. And that's when we were getting 8, 9 applications. So I'm saying we gotta work with them to say, we don't want just Amy to do it. You know, I don't know how we're gonna do, we gotta write a nice letter that isn't insulting, but yet to tell them what we want. We want them all to get
And
it.
Amy also said that she told, I can't get the second one's name.
The other guidance counselor, I don't know their names anymore.
but there's a lot of people that don't want to go into nursing anymore.
Well, that's the other question.
Yeah.
We're giving it up till
Mm.
3 years, 4
Yeah,
years
when I first started, you were
to
getting-
other medical fields.
Yeah.
You know,
Like
dietitian,
respiratory
speech
Yeah.
pathology,
Yeah.
and maybe we need, that's what I want you to think about over the summer, and in
Mhm.
September, let's have a
But
conversation
well,
about it.
The money for nursing education is drying up, so if we want to have nurses, it would be good to support them, but we have to get people to want to go into nursing.
True. They're not that motivated to do that anymore, you know?
To do.
Go into
Doing it
nursing.
aren't that motivated.
What's that?
Even the ones doing it, they're very.
It's
It's a tough
really,
field now.
it is, because
It
there's so
is.
many opportunities. in
Oh,
nursing.
it's there are.
It's
Like I
wonderful.
changed my job.
Yeah.
Yeah.
So.
that's,
I think that might be part of the problem, you know?
there's just.
That there's
Your
not an
idea
interest.
was to
like there
go
used
in
to
and
be.
talk
Like
about,
if they were doing career days or something that we could
Yeah.
offer, I mean.
yeah, that would be
You know?
great. Yeah.
Well,
But I mean,
let's
A long time ago, everyone wanted
percolate
to
it
be a
on,
nurse
percolate on it.
or a teacher.
Well, I think
My son
that,
just got a teacher.
Find that.
I
Not
think
what
that
about
the opportunities for women were a little more limited.
I have one other,
Absolutely.
I have
And that
another
was-
And now,
scholarship
you know,
issue.
for a
Oh,
woman
and the
to be a
scholarship
nurse,
issue.
it's not
Hold on.
such a.
Well, with the
Whatever.
advanced practice nurses though, in independent practice, it's actually a great field.
Right, a friend of mine, she's saying she's a PA, she
Yeah.
makes more than some of her friends work.
Do you folks
Yeah.
remember, Taylor Festa?
I gotta step away for a minute. Someone's at the door. Hold on. Go ahead.
Okay, that's okay.
Okay.
Taylor Festa was, received just a scholarship, in 2024. And when Sharon was sending out the second call for, applications, I had her do it 2 times this year because we didn't get any.
Unfortunately, I included Sarah's email with the guidance counselor.
So she sends us a note saying, I hope this email finds you well. My name is Taylor Festa. I was a recipient. She goes on and she says, since no one's applied for the scholarship, can I apply again? And Betsy called me because I think she got this first. And I said, well, let's bring it up. But I'm thinking what we could.
So did she apply and not get it, or?
No, she got it.
But she
She's,
wants more.
she
When?
wants more.
Last
Well, she'll get it, she'll get
Last
it,
year, and she got the
Yeah.
$7,000.
so she'll get the 7 this year. Well, what I was thinking of saying to her to kind of keep her interested and kind of make nice is tell her about the adult scholarship. So
yes.
when she finishes,
Mhm.
and so yeah, I'm gonna tell Betsy that,
Right.
but I thought we had to address it in some
Yeah.
way.
Well,
Mine-
kudos to her for trying.
I appreciate that, yeah.
I know, right?
Mine
Yeah.
way.
And I did send her an email back saying, I'm sorry.
What's that?
I sent an email back to her saying, I'm sorry that I included it with the guidance counselors too. But that we were going to check on.
Yeah, well, that's okay, because, good for her for asking, but I'm gonna have Betsy just tell her about our second scholarship that she could apply for.
You know, and then if we do give it to her, we're kind of in a mix of having to offer to whoever the other person too. And
Then
if
they'll
you get
come back.
into- Yeah.
Yeah, how come you didn't call me?
Yeah.
All right, so that, everybody agrees on that, we don't have to vote on that, I'll just say. Okay, I think we're getting down to the bottom of it. That's something for business and everything. That was the only correspondence.
That should be corrected to the other 3 checks that I got today, so.
Okay, so that's,
So it's 250. 3 checks.
You work today?
Worked for
But
correspondence.
that's what we got.
We
Double
checks for
delivered
250.
our driveway.
Mm-hmm.
So my husband is like,
250.
and I said, I'll help very much.
and
So I
that's,
have to show it, so.
we've got 250 more, just to tell
Oh,
you.
great.
That's correspondence, 3 more checks. 3, was it?
Mm-hmm.
Yeah, okay. We'll take care of that. And I think that it's. No.
Still worse than that.
Oh, you, the family, but we don't have.
I'm here.
Oh, there she is.
Hey, Diane. I've always been sitting
Well, I'm
right
still-
next to you.
I'm just looking for,
You're looking for, no,
Mary
no,
Ann.
you're looking for
Mary
Mary Ann.
I-
Yeah, she's at the library now, right?
She
Yeah.
is, they're building a new library.
Yeah.
She's on that committee.
I see her there
If
sometimes.
they're
You're
really
on.
they're not building a new library, but they're rebuilding the interior.
Really? Yeah.
Yeah, it's gonna be interesting, and it's gonna have the big meeting room on the first floor.
Well,
Yeah.
we have a representative.
Yes, from Youth and Family Services. We just actually had a meeting on Tuesday. And I met the, is Jay back? Should I wait for him or no? No.
Okay.
Oh, does he have to vote? Are we informed?
He said
Without him?
Someone
was at the
Yeah, we have a forum.
Yeah, okay, then we're, okay, okay. And so anyway, I met the interim acting, police chief. Oh, did you? Oh, my,
Oh,
Walsh, my
yes.
neighbors.
Yeah.
Well,
He's your neighbor?
no, the parents are my neighbor.
Oh,
The parents. His parents?
Yes.
Okay.
So how
He's,
old the
how
gentleman
old is he? I don't know. I'm guessing in his fifties. Oh, yeah, they're probably in theirs.
I think early fifties.
Yeah, early fifties, yeah. He was, I remember him.
He got
because-
shot in the foot, didn't he?
No, no.
Wasn't he?
No.
Don't know. But you got those in the foot here.
No.
Okay.
Oh, I do, yes. Yeah, it's very,
Sure
his,
knows everybody.
He was
his
the,
parents are very good friends with my brother-in-law sister.
I remember him from the high school because I was the nurse at the high school for 9 months here when we first moved here. Okay. And he was the resource officer there.
Oh,
That was so funny. So now he's worked his way up to an interim.
So he came to the meeting.
He came
too?
to the meeting, yes, and another police officer was there too. And so they were talking about, this week is prevention week, and they're doing a lot of things down at Saybrook Point for awareness, like suicide prevention, et cetera, things like that.
Right.
He was talking about maybe this is why the police were involved. There's a program that he wants the elderly to register for. If you know of anyone,
I know.
bring me back home program.
Oh,
for
really?
People that get lost.
Oh.
Wandering family members, they're looking for.
He's gonna start that?
I guess it's something that that's in the process of that they're doing. They're registering for that program now, and that's the name of it, Bring Me Back Home, but they don't have too many people registered at this.
Well, they probably don't know about it.
Yes, right.
And that's, the estuary would be the place to bring it.
Yeah,
Yeah.
Michaela actually
Yeah.
would be the place to,
She probably
already
knows.
knows about it,
I
yeah.
actually, someone mentioned her name too while
Yeah.
I was there.
And she'd be good to be.
She's very active with youth and family services.
Yes, she is. She is.
Um,
Yeah.
They also got some ARPA funding, for a bilingual educator, to do story time at the Acton Library. There's a need for that and at
So
Goodwin.
you're using family got the money.
Yes,
Oh,
yeah.
that's great.
Yeah.
And have they found anybody to do it?
Yes,
Okay.
yes, yeah.
That's great.
And
And I'm sorry,
Did you
what
say
kind
that's
of programs are they?
it's, they have a they have a woman that is doing bilingual education. And she goes to Goodwin and also at the Acton Library, just to help kids understand, all these kids that are Spanish speaking aren't quite getting what they're supposed to be getting because they're not, they're trying to teach them Spanish and they're learning English and anyway, they're finding it's very helpful. They also have an employee workshop for teens now. There's a lot of kids, again, they were saying that are home after school.
Yeah.
They don't have jobs. I don't know why. They don't know why. They don't know if they don't want jobs, if their parents don't want them to work, or what the issues are. So they're trying to do a workshop for that.
I know, when my kids, believe it or not, a lot of kids didn't work in this town, and,
Yeah.
you know, I made them work.
Yeah.
I was the
But a
older.
lot of it is getting them to the job too, you know what I mean? So
Yeah.
like
That's
parents
true.
who are
Yeah,
working and their
transportation.
kids want a job after school, they're not
Yeah.
riding or they don't have a
Well,
car.
you have to, like, my kids rode their bikes to their jobs, and then,
That's true.
Right, but
Ride their
it
bikes.
depends where they are.
yeah, it was close enough, because
Yeah.
we lived
Right.
close to Main Street, you know.
And then they talked a lot about summer programs and.
So he's very active already, the new, police chief.
Yeah, yeah,
Interim.
yeah,
Yeah.
Sounds like
that's
it's
good.
bringing some new ideas.
yeah,
Yeah.
yeah.
That's good.
And
I
he was
like-
great as a
I like
resource
hearing all
officer.
that,
Yeah,
all positive
cool.
stuff.
but it was so funny to see him again. I mean, I haven't seen him since what, 2008? No, 2009 maybe, something like that. But yeah,
Is he, do you know if he's gonna apply for the job?
I don't know. I didn't ask him. I mean, I'm sure I would think.
I got
I
I
wasn't, yeah. He's not.
No, it's a big job.
No, he said he's too old.
He's too old.
I'm not exactly sure.
Well, he probably doesn't like the politics of it. There's a lot of politics involved in being police chief. And some people love that and some people do not.
Yeah. I hate it.
Yeah. And I think oh, actually, her name is Cassandra Garcia. It's called Exploramus. That program that they have.
Is
For
what
bilingual, the bilingual education.
Exploramus.
Exploramus.
So it was good, you
Yeah.
liked going?
Yeah,
Good.
yeah.
When's your next meeting?
June 3rd. June 3rd,
Right.
yeah.
Right, they meet over the summer?
Yes, they do. I believe so. I mean, I didn't know if I got a schedule of the summer meetings,
I
but,
don't think they do.
oh, no, they don't?
Oh, place to put them,
Oh, okay, maybe they don't. I don't know, it's only my second time going, so maybe they don't. The director there, Heather, is that?
Mhm.
She's very good. Very
Oh,
good.
she's been wonderful.
Yeah.
For
She's been there a long time.
for the program.
Yeah.
As a director.
Yeah. Very good.
She's, extremely, hands-on,
Yeah, definitely.
doing-
Right on top of everything. Can tell.
goes above and beyond.
Yeah. Yeah, that's nice.
All right. The other thing, we don't meet, you know, over the summer. So unless we have to, you know, I have called a couple of meetings, but we don't usually meet.
We can go to your house.
I'd love to get it, I just. I'll tell you after, and then you go, I have to have it online. Still,
Okay, exactly, there you are.
But I'm listening.
Miss anything, we just give a recap of the.
right.
Did we talk about the nurse's gift?
No, not yet.
No,
That's-
that's the last thing.
To do
Who
that?
wants to do it?
I can do it.
You don't mind?
No.
Well, we
What
usually,
should you-
for
some people
still a
didn't
day.
know, I don't-
For nurses, we
For
give them a
nurses,
gift.
I know.
What do you
Yeah.
want to give them?
Last year, we actually bought them each a $50 gift certificate, you know, like
Card
a
for-
Visa card or something. I think it was it a Visa card?
I thought they did it to a nail. No, I guess they did it, I think she did it because then they could use it anywhere.
Yes.
So if they
Yeah,
don't want to.
because sometimes American Express, they don't let you use it everywhere, so, she went and bought, there's.
One at Goodwin,
Right.
one at the
One
high
at-
school.
Right, you have the names?
I do not.
Yeah.
Goodwin, middle
High
school,
school.
high school, and St. John.
St. John.
Right.
John.
There might be two at Goodwin, they might, I don't know if they share a position. Sometimes they do that, I don't know right now, but it
Okay.
might mean you might have to call the school
Oh,
and just
okay.
find out. And their names, because then we get a card for each of them.
Mhm.
And, deliver them.
I did it too gently.
I know, I know. I'm always afraid to say it, but I appreciate it, thank you. She's, Priscilla usually does it, but she's away and then she's going on a trip to Paris.
Oh, good for
Very
her.
good for her. I said, well, don't worry. She says, oh, I'll do it when I come back. I said, no, we should really get it done.
That's fine.
Yeah,
So we want to do gift cards?
I think so. I mean, who wouldn't
$50
want to get a $50 gift
No, I
card?
think.
Before we gave them several times pedicure.
Yeah,
We gave
you're
them.
right.
what
Some
else
people
did we
don't
give
like
them?
those anyway.
Yeah, but you like those.
Yeah,
we-
I mean, I have, I would if I had nice hands, but.
I know mine are terrible. Planting them.
Yeah,
So I
me
think
too.
they're dirt in my
My
nails.
fingers, they're so.
You
unsweet.
did?
And now they're swollen.
Oh, no. Okay, so that's good. Jay,
What are we proposing? 50, 75? What's the,
$50 to each
So,
nurse.
what is it coming out of? What fund?
It comes out of the Flanagan money because that was, that's what they had that for. When they took it, the board made it for nurse appreciation, nurse education and all that. So we still do that, but we expanded what Flanagan is for. We give a nursing scholarship to adults. So yes, that's where it comes from, just.
I make a motion, we provide a gift certificate to, I don't know, 3 or 4 nurses in town for Nurse Appreciation Day.
And cards.
And cards. Yeah.
And don't buy one for Tina because she's not allowed to accept it.
Oh, wow.
She gave it back and, we donated it last year to the scholarship fund. I think that's what we did with it, right?
Am I gonna find a card for nurses week now? It's
No.
over.
No, just thank you cards.
Yeah, so when Tina's back working for us, we can give her one. Right. She used to be able to take it before. Yale won't let her.
You can give her flowers, you can't give her.
I know. Well, when she leaves,
Great.
they can't stop us from getting something for her when she leaves.
Yeah.
We get her
give her
a
nice
nice
gift.
Yeah,
Cards, so.
she's been with us for so many years.
So I'll find out how many nurses first,
Yeah,
and then I'll
I
get them
think
on
it's-
cards, and then I'll get.
Might be 5.
And we've always given 50, is that?
Yeah,
Is that
that's
enough?
what we usually, yeah, that's good.
We need a second.
Yeah.
We need a second.
Oh, second, I second it.
All right, you go ahead.
Second.
Okay, all in favor? Any opposition?
No.
Okay, motion
Great.
carried.
Be appreciated.
And that's all I have unless somebody else has something. And next month will be our last meeting.
Okay.
And Sharon's gonna get, who does she notify with this new applicant?
Well, she's going to let, she'll let Amy know about the approval of this scholarship. And then I'll make up the certificate and everything and I drop it off at the school. Because what we've been doing is having, Amy present it. Instead of having.
Sure, but I meant the one that's still open.
Oh, she's gonna call Amy because they have a communication.
And Sharon's gonna communicate to you?
And then she'll let me know and I'll send out an email to you.
Okay, great. And when's the awards night?
I bet we'll find out,
I know what it is.
and it's,
Okay, so okay. Everybody's on board here.
maybe in May, Jay. The award thing may be in May, so we may miss it.
Oh, I see.
Yeah, but that's okay. They still get the
She
money.
liked the money anyway.
Yeah.
I mean, should we, if it hasn't happened yet, should we get it to the person we just voted on,
Yeah.
the
Oh,
certificate?
yeah.
Yeah.
I'm gonna do this
Oh, all right.
I'll do this and drop it off at the school.
Oh, good, good, good.
I just make them a little certificate and a letter explaining how they get their scholarship.
Yes.
I can pass that on to Betsy. I should do that.
Thursday, May 29th is the senior.
Oh,
awards.
Oh, so
okay.
she still has an opportunity to get it into us. if she wants it.
Yeah.
Okay, so our meeting is before that, so.
Yes.
You know,
Which meeting?
right?
No, this is May.
Right.
That's a June meeting. Our June meeting,
Damn. What's that?
the June meeting's after the, that awards night.
Yeah.
Yeah.
Yeah, we just figured that out.
But you're not sending, nobody's going to present it. You're gonna just have Amy present it.
Amy presents, yeah. She'll ask us, she'll be sending an email.
Oh, because when I talk to her too, so I can. let her
Yeah,
know.
just tell her she can present it. It's very long, goes on and on and on. So if anybody does want to go, I'm fine with it, they go, but I did it for so long, I'm just saying. Okay.
Huh?
All right, Jack.
Okay, we'll see you next month.
All right.
Hope to meet our new member then. Okay, great. Welcome. Have a great month or Memorial Day, whatever.
Okay,
Okay, bye now.
in favor?
Aye.
Aye. We're
Aye.
adjourning.